licking at his paws and really scratching.
Sure.
His face, like he'll smash his face into my couch and just itch.
And rub, yeah. Can I ask, how did you find out that he was allergic to wheat? Like, did you do a test, or what was involved?
Actually, I took him up to the vet, and they did a pile of testing on him, and that's what it was. It was the wheat.
Yeah, the reason that surprises me, and obviously bring this up, and your veterinarian knows better than I do as far as this specific case, but when you get food allergies, which is a little bit different than food sensitivity, but it's the food allergies that cause the itchiness. Dogs and cats are allergic to protein, and the reason is protein molecules are kind of too large for the body and kind of cause upset issues. And there's really no protein in wheat. So we talk about sort of gluten allergies or gluten sensitivities in people, and the wheat has gluten in it, and we kind of sometimes transfer that over to animals. So generally when I diagnose a food allergy, and if there's financial reasons or time constraints that we're not able to send the dog to a dermatologist to get tested for the exact thing that they're allergic to, it's always protein. So whether it's chicken or beef or the protein that you'll find in eggs or whatever, depending on the food, we end up having to get out what's called a novel protein source. So it sounds like there may be a bit of a miscommunication there, or obviously there's something else that your dog's allergic to. Now your veterinarian can recommend some very specific, and there's various options, probably about 10 different options out there, of food that's designed for food allergies. And they work very, very well. You need to give it a good 8-week sort of trial period, but they work very, very well. But it sounds like you've only covered kind of half the problem. You're essentially going to just lift the lip and just go back and forth. You know, and people, we're taught to go down, down, down. That would be great if you could do that with a dog or cat, but let's be honest, it's pretty difficult.
They're showing my bad side right now on the TV.
You're just going to go, yeah, that's right. They're showing the bad teeth here. You're just going to go back and forth. You want to focus on the back teeth. Now, if you have not brushed your dog or your cat's teeth, and your dog or cat are older than, say, 6 months old, they are going to have a bit of gingivitis. It's inevitable. And what you're going to see is the first time you brush your teeth, there's going to be a tiny bit of blood. So don't panic. Just do a little bit, and then go on, wait 3 days, and then come back and brush again. And eventually you should be doing this once a day. I mean, they say nutrition is our medicine. I think it was Socrates that said it many years ago, obviously, and it's the same for pets. We can use food to help delay the onset of diseases, to help control diseases along with your veterinarian care, help improve quality of life, lifespan. It's going to be great.
Yeah, and before we continue, I would like to congratulate our winner from last week. Once again, every single week we give something away on this show. So congratulations to Tom Fitzgerald, who has won himself a water dog courtesy of Contact Inc. Great product, and today we're going to be giving another product away. Now, I want to talk to you right off the bat about nutrition.
Yep.
Just a very basic question. What is nutrition? Is it different from animals as opposed to humans?
I mean, obviously the different quantities of food or the different quantity of nutrients that they take in are different, obviously, for animals and for people. I mean, cats are more meat eaters, and dogs more like us, being omnivores, but you know, the importance of the nutrition is the same. I'm hoping the viewers are going to call in today. I want to talk about commercially prepared dog food versus homemade dog food. I want to talk about the common raw and bones and raw food diets that are out there. I want to talk about ash in the cat food and the importance with urinary health, preservatives versus organic, all life stage versus, you know, large breed puppies. There's so much stuff to talk about.
And the overall one, the big one, is an AAFCO statement. And what people don't know about the AAFCO statement.
I mean, there is unfortunately no control regarding the marketing or the labeling of food. And so there's a lot of misinformation out there, and it can cause some serious problems. So that's going to be a great talk.
Yeah. So call the show. Call the show. That's the most important thing. Get on the phone lines. Call the show. And if you can't call the show and you want to just give us your opinion, you can email us at yourpetyourvet@rogerstv.com. I believe that's the email address. I don't know. It'll be on the screen.
That's right.
If it's not, I'm sorry. It'll bounce back to you. But if it is, it's great. It's going to come to us. Dr. Cliff will always respond to your emails. So just remember that. He will always respond to your emails, especially about a topic like this, which is very dear to Dr. Cliff. And you and I have been talking about this for days. And I'm really excited about this.
I did want to bring up, last week, or in a previous show a couple of weeks ago, we were talking about toxicities in dogs and cats. And a caller called in and asked about nuts being toxic to dogs. We had a great email after the show from Diane. Thank you very much, Diane. I had actually forgotten about macadamia nuts. Macadamia nuts are toxic to dogs if given in too high a quantity. They have too much phosphorus. So thank you very much, Diane. I just wanted to bring that out before we forgot. A little bit of housekeeping there at the beginning of the show. So, you know, if you guys ever catch me on something, throw me an email and I'll be happy to correct myself.
And once again, we have Sharon Cars, who's going to be joining us a little bit later on from Durham. She's from the Second Chance Wildlife Sanctuary in Durham.
A great cat rescue.
Oh, fantastic. We have some great cats over here in studio today. Hopefully, they won't be running around, and if they do, it's live TV, and
we'll see what happens.
That's what happens. So I'm going to ask you something right off the bat about nutrition. The common question that I have, and I'm sure a lot of our viewers have at home, is all life stages.
Yeah.
These are one of the things that I keep hearing about, all life stages with food. So what is an all life stage food?
I mean, the hair on the back of my head's already, or the back of my neck's starting to stand up. It's such a big topic. There are foods out there that have a recommendation or saying that they're healthy for all life stages, meaning, let's say we're talking about cats, adult cats right up to the senior cats, and obviously for dogs from puppies up to seniors. In my opinion, and you know, speak with your veterinary health care team because they know the information as well, but very, very dangerous to feed a kitten the same thing that you're going to feed a full-grown cat or a senior. Large breed dogs, a classic example. So any dog that's over 55 pounds as an adult, you know, Rottweilers, Shepherds, Labradors, and about most of the dogs out there, a large percentage of them are large breed puppies. There's a common misinformation out there about feeding large breed puppies adult food when they hit 6 months. And this is to kind of control the hip dysplasia and the growth issues that they have. Old information, very, very bad idea. You need to stick with a puppy food and one that's designed for large breed dogs. So very, very important that you stay away from all life stage foods. It's convenient because then you can feed your senior cat what your kitten's getting, but not the right thing.
So basically, some of the risks could be like right off the top when I'm thinking about, say I have a puppy.
Yeah.
And an all life stage diet could be too much calcium or too much of a certain protein for that type of dog. Absolutely. And vice versa, and you don't want to have that imbalance.
Absolutely, yeah. I mean, if you've got a Labrador, obviously, and if you were to feed Romeo a all life stage food, and he had some genetic predispositions to hip dysplasia, that's going to make hip dysplasia worse, as well as elbow dysplasia or other growth abnormalities. On the flip side, Romeo's getting into his more senior years now.
Yeah.
If you feed him food that's designed for a middle-aged dog instead of a senior dog, you can risk worsening kidney disease.
Really?
You can cause obesity to be more of a problem. You know, you're not giving them the nutrients that might help with senior brain health or arthritis. You know, it's very, very important. I don't eat what I feed my children, and my father doesn't eat what I eat. It's different. You've got to listen to your veterinarian. Avoid the marketing that says that all this is appropriate. It isn't. You need to speak with your veterinarian.
We're excited, and if you're watching this right now, this is a show that you cannot miss. It's coming up, but you can tell everybody, it's a little bit of a teaser.
Yeah, we had Lily May over at my clinic in Markham, and we did a space surgery on her. She's a cat, as well as we kind of did a segment on laser surgery versus scalpel surgery. So we've got some images that are family appropriate. You know, there might be a little bit of redness there going on in the scalpel surgery, but we get to talk about what a space surgery is and how it's a total ovariohysterectomy, and kind of why we do these things and all the steps that are taken to keep these animals safe. It was quite a eye opener for the cameraman and for the producer who came. They were quite impressed actually with how detailed these surgeries are.
Now, was it a laser surgery?
It was. It was, but we also had another cat there that was getting it was a rescue cat. So because the laser surgery does cost a little bit more, we opted to go with the scalpel blade, which is okay. A little bit more pain control that has to be dealt with, but this way we could have a view of comparing the two, which I know the viewers will love.
Specifically laser surgery versus sort of the time-tested true version of a scalpel blade or a knife procedure. The laser is, in my opinion and an expert's opinion, better than a scalpel because it cauterizes the vessels so you get less bleeding, which makes the surgery procedure faster. The other things it does is it actually speeds up the healing process, and it also reduces inflammation. And inflammation is the key reason for pain post-surgically. Belly feels good. Now, regarding surgical procedures in general, these are procedures where an animal is going under general anesthesia. The animal should have a really good physical exam done prior to the anesthesia several weeks before, if possible, as well as some blood work done. This blood work helps us determine if there's any sort of liver or kidney or hidden abnormalities that may be important. You're then going to obviously want to do a physical exam the day of the surgery, listen to the heart, listen to the lungs, make sure everything sounds fine, and make sure that patient is stable as well. Once they're under anesthesia, what's going to happen is initially they're going to get an injection of a pain medication and sometimes a sedative, and that's just to kind of make them feel more comfortable. It's going to relax them a little bit and take away some of the pain that's going to be happening during the surgery and as they recover as well. So in the first surgery, we used a scalpel blade. Now this is a cat rescue spay that we're using the scalpel blade for because there's financial issues. The laser surgery is a little more costly, so we stick with a scalpel blade. And as you'll see when I make the incision, there's a little more bleeding and there's some little tiny skin bleeders, the redness that shows up, and those are simply little capillaries that are bleeding when I make this incision. After the surgery, there's going to be a little bit more puffiness and a little bit more inflammation. But otherwise, the scalpel blade is the same technique and the same incisions that you make with a laser. Now in the next patient, we actually did use a surgical laser to make the incision and to make any sort of cuts, whether it was removing the uterus or making an incision into the abdomen. There's going to be a little bit of smoke and a vacuum used to remove that smoke so that the surgeon doesn't have to breathe it in. But otherwise, it's a very fast and in my opinion, a bit of a cleaner surgery. That's through the skin. This moistened. Now during the surgery you're going to want to monitor anesthetic depth as well, and there are different tools out there. The most important thing is just having a registered vet technician, which is kind of like a nurse for animals, and there's some sort of tools or machines that can help us as well. You're going to want to measure the blood pressure regularly, whether that's through what's called a Doppler or a PET map or a Cardell, and then also you're going to want to make sure that these animals are kept warm because you're going to be going into the abdomen, they're going to be getting some fluids that can cool their bodies off, so even just having a heating blanket underneath them can actually speed up recovery significantly. That's generally how surgery goes. You know, it's a pretty standard procedure at any veterinary clinic, but it's really important that you speak with your veterinarian and make sure that these high standards are utilized to keep the patient as safe as possible.
The pleasure of meeting and talking with the dog whisperer, the famous Mr. Cesar Millan. Thanks for joining us.
Thank you for having me.
First off, you had a great choice in picking Canadian Tire as the Canadian branding agent here in Canada for your new product line. I guess it's either Tim Hortons or Canadian Tire that you're going to deal with, right?